Saram, dearest elders, brothers and sisters, we shall now present the Healthcare Vision for 2020. My name is Nirali Sisodia and I'm the Region 4 Healthcare Lead and the Joint National Young Adults Coordinator. We have been blessed to have the NHS in this country, with its services echoing Swami's teachings of love all, serve all, and free healthcare. So, what advice does Swami give to healthcare volunteers? Swami says, look upon your patients as your own kith and kin, as your special guests, and as your closest friends. Attend to them lovingly and unflinching care. I call upon you to maintain this attitude in every situation. So Swami has instructed to treat all patients as our own family and treat them with the highest love and commitment. With this in mind, what healthcare did the SSIO provide to people in the UK and internationally in 2019? Well, we provided health checkups to those in the UK and internationally. We provided advice and referral to external services in the community where it was required. We provided mental health and well-being support not only to our devotees but those who were also homeless. We provided food, toiletries, glasses, and did a dental checkup and treatment for those people who are in the most vulnerable situations. And the beauty of it, all of this was free of charge. So, what is the vision for 2020 and forward? So firstly, identifying the need in your area. Swami had told the UK young adults in 2004 to find the need. Where is the gap in your area? Who needs help the most? And how can we make this happen? Through collaborative working, partnership with other organizations, health or non-healthcare related, to create or optimize services that may already be present. For example, in Leicester, they have been working with the homeless charity and with the local clinical commissioning group to create healthcare for the homeless initiatives. Thirdly, to provide safety for our patients and volunteers. Certainly at this time, during this pandemic, we are faced with this as a challenge, and moving forward, we must ensure the safety of all. In addition, we also need to make sure that our healthcare volunteers have the correct indemnity to ensure that they are able to serve on a voluntary basis. Fourthly, we wish to continue our free healthcare and advice service in line with the national and local healthcare objectives of the NHS as well as the international Satya Sai Global Healthcare Mission, and all of this delivered with compassion. We have now formed the National Healthcare Committee in 2020. The purpose of this team is to regulate the healthcare activities throughout the UK. So this is making sure that all the activities are as per our country's guidance. Therefore, we will also create guidance documents to standardize practices across the country and be able to provide the support to each of the regions to facilitate the healthcare activities. We also want to provide our healthcare volunteers and general volunteers with the opportunity to serve across all levels, so that's locally, nationally, and internationally. And finally, providing training and education, seminars and conferences to learn from each other and increase our knowledge and actually ensure that we are working to best practices. So who are your regional representatives on the committee? Here you can see from regions 1 to 8, we have our regional representatives who sit on the National Healthcare Committee. Our chair is Dr. Surendra Upadhyay. So to start with, we invite all healthcare professionals to register on the National Healthcare Register so that we can keep you informed of healthcare activities happening within your region as well as those happening internationally. Also, we can contact you if you have an area of expertise that we are looking for. So please do register. And this is for all healthcare professionals, whether they are within the organization or beyond the organization. So what is our national project? Well, our national project this year in light of COVID-19 is the National Visors Project 2020, where over 4,500 handmade visors have been distributed already throughout the UK to care homes and hospitals, and this number is rising. You may ask, how did we achieve delivering over 4,500 visors across the country? There are two reasons. The first reason is teamwork. The second reason is Swami's miracle. For example, in one region, service coordinators in collaboration with young adults came together to strategize, and they created a team where everybody had a responsibility to either acquire, to deliver, or to make the visors. So by working together, this was made possible. And also Swami's miracle, where 9,000 pre-cut acetate shields were made and donated to the SSIO UK. This meant that the visors could be assembled more rapidly. And on average, with a team of 3 people, 25 visors can be made per hour. So it's a great family activity. And the need is still here. And if you would still like to get involved with making visors, delivering visors, or even procurement, then please contact your regional service coordinator, who will be able to arrange all of this for you and have a chat about how you can contribute to the cause. So what else do we hope to achieve in 2020 in terms of our healthcare activities? We still wish to run health awareness seminars for the public and for the homeless, and this can be delivered due to the advent of technology and how forward we've come with this. There's also an opportunity to donate blood or even plasma. And also we are looking at partnering with other organizations to help at-risk populations at this time with mental health and with literacy. We are developing guidelines and handbooks to help regions organize these health events, as well as collate healthcare activity that have been happening across all of the regions. So how can we get involved? Firstly, sign up on the National Healthcare Register. Secondly, find the need. So this is the National Visors Project. So get in touch with your centre coordinators, presidents, regional service lead or healthcare lead to find how you can contribute to the National Visors Project. Also, if you find within your regions or within your locality that there are other healthcare needs that you've come across, then please do communicate those to your centre coordinators and presidents and your healthcare leads as well. So that concludes this presentation on healthcare services in 2020. Again, if you would like to get in touch to find out more, then please do contact us at healthcare@srisatyasai.org.uk. Let us go forward and let us continue to serve with love and compassion, just as our dearest Bhagavan. Jai Saram.